Hey, good morning, everyone, and thank you for joining us this Saturday morning for our Taking Care of the Girls Breast Cancer Awareness Workshop. We appreciate each and every one of you for being here in attendance. So really quickly, I'm going to go through the slides before we get to our presentation. This is the agenda for today with our welcome and housekeeping and a little bit about what we do, our panelists, the presentations, and then we'll move to Q&A. And we're going to also do a survey. We're going to do a live survey. So please stay on. So housekeeping, please keep your mics on mute. Ask questions. So, you can unmute yourself. Well, during the presentation, we prefer if you drop the questions in the chat, but then there will also be a session of time where you can unmute yourselves and verbally ask your questions. So, and also complete survey for a chance to win a prize. And so this is about us. We are the Urban Health Initiative, which is UChicago Medicine's community health division responsible for collaborating with community-based organizations on health-related programs, research, and services for residents on the south side of Chicago. And some of the things that we do, health and wellness programs, sponsorship events, our weekly WVON radio show, community newsletters, fitness classes, weekly fitness classes that are free, and health fairs. Please follow us on social media at UCM Urban Health Initiative, to keep up with a lot of things that we're doing. Often we have a lot of great posts and information that we share. So please follow us. And some of our upcoming events, next Saturday in person, we have our high school healthcare career event, which is an amazing event for our youth, introduces them to various healthcare careers. And they get to actually sit and talk with these professionals and learn about these programs. So it's a great event, again, next Saturday. And then the following Saturday, we have our in-person Women and Girls Health event, which is also going to be an amazing event for our young girls, our moms, or any of us who want to learn more about health, health and wellness as relates to women and girls. So it's an in-person event as well. So again, these events will be shared with you so that you can register for them. And then we have our third one, which is our Friendsgiving event, which is a diabetes awareness event, which is Saturday, November the 18th. So all of these events that we're sharing with you they'll be shared with you in a follow-up email that we're going to send out. So no need to try to take this all down right now. We're going to share with you so that you can register and hope to show up. So today, again, stick around for the raffle. This is our beautiful prize. So if your name is selected, you have a chance to win this TGIN wonderful hair care product packet. So this is great. I wish I could enter for this, but I can't. So let's meet our speakers. Okay, first up, we have Dr. Jessica Anyaso, who is an anesthesiology resident physician at UChicago Medicine. She's a Chicago native whose hobbies include running, cooking, watching Nollywood films, and traveling. Dr. Anyaso is excited to be a part of the Community Champions program and is looking forward to giving back to her community. Thank you so much, Dr. Anyaso, for being here. And then we have Doris Goodwin, who is our breast cancer survivor. Ms. Doris Goodwin has been married to her college sweetheart for 18 years and is a mom to 3 busy girls, ages 11, 13, and 15. Ms. Goodwin is a government administrator who recently decided to go back to school after a 25-year hiatus. Congratulations on that. The Chicago Stepper is a 9-year stage 2 breast cancer survivor. Yay, congratulations on that. That's wonderful. And then we have Gianna Calixto, who is our director of Equal Hope. Ms. Gianna Calixto is the Director of Community Health and Engagement at Equal Hope. Ms. Calixto has over 10 years of experience as a public health care professional, skilled in interpersonal and public communication among culturally diverse populations. Born and raised in the Humboldt Park community of Chicago, Ms. Calixto moved back from San Diego 5 years ago to continue her public health career as a fellow advocate. Thank you so much, Gianna, for being here. Okay. And I'm gonna stop sharing now so that we can get started. We are going to move into our first presentation with Dr. Anyaso. Thank you and welcome.
Thank you for having me. Okay. Good morning, everyone. As she introduced, I'm Dr. Jessica Anyaso. I'm an anesthesiology resident physician, and I'm an Urban Health Initiative Community Champion. Today's presentation is going to be on breast cancer awareness, as it is the National Breast Cancer Awareness Month. Okay, so first I would like to talk about what is breast cancer. So breast cancer is a disease in which cells in the breast grow out of control. So the cell in the breast just divides and divides and divides, and as it says, it grows out of control. Breast cancer, it's the most common cancer in women in the United States, and it's the second leading cause of cancer death among women. So the third bullet point I have highlighted because it's such a significant statistic. 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime. Each year, about 240,000 cases are diagnosed in women. Black women are 40% more likely to die from breast cancer than white women. And the 5-year relative survival rate is 91%. As you can see, based on these statistics, knowledge is power. It's important for us to inform ourselves on, what breast cancer is, early detection of it, screening, and just more information on the different types. So going into the different types, I would like to first talk about the anatomy of the breast. So we have the nipple, which is the protrusion of the breast. Surrounding the nipple is the pigmented area or the colored region, which is known as the areola. The breast tissue is composed of fat, and also it has a lobes, and within the lobes are small little lobules and ducts that drain to the nipple that provide, the milk when you're lactating or when you're breastfeeding. So breast cancer types are classified based off of location and spread. So location, which part of the breast is affected, and spread, how far has the breast cancer spread? And just for example, we have ductal carcinoma in situ, right? So it sounds like a very long, very long word, but when you break it down, ductal, so within the duct of the breast, carcinoma, cancer, and in situ means it's contained. Whereas invasive ductal carcinoma means that it has invaded further than the breast into the blood or into the lymphatics. Same thing with lobular carcinoma in situ. It's contained within the lobules of the breast. Invasive, it has spread further. And there are more other types that are listed below, but I won't go into too much detail. What are the warning signs of breast cancer? What are some of the things that you would like to look out for? So any new lumps or masses is definitely something to look out for, especially in the breast or in the underarm region. So the breast tends to drain, it drains its lymphatics through the armpit region. And so that's why if you have a lump under the armpit too, that could be concerning. Thickening or swelling of part of the breast, irritation or dimpling of the breast skin, redness or flaky skin in the nipple area, pulling in of the nipple or pain in the nipple area, pain in any area of the breast, nipple discharge, especially if it's anything other than milk like blood, and any change in the size or the shape of the breast. On the right side, you can see something known as peau d'orange, which is French for skin of an orange. And this is what the breast would look like in inflammatory breast cancer. So you have dimpling of the skin, and this appearance is due to the lymphatic system being blocked off. So what are the risk factors for breast cancer? You can't pinpoint it to just one thing. So there are multiple things that contribute to breast cancer. And I like to divide it up based on genetics and environmental. So genetics, The first thing I have is age. So the older you are, the more likely you are to get breast cancer. Gender. As we know, females are more likely to get breast cancer than males. Family history of breast cancer, and especially immediate family history of breast cancer. So your father, your mother, your sibling, or your child. Having a particular breast cancer gene mutation, like BRCA1 or BRCA2. Breast tissue density. So the more dense the breast tissue is, the more likely. And the timing of your menstrual period, the timing that you get it, and the time that you enter menopause. So the earlier you go through, the earlier you get your menstrual period, the more at risk. The later you get menopause, the more at risk. And that just has to do with, the amount of time that you're exposed to hormones. So you can see all of these factors are outside of your control, and hence why they are genetic risk factors. Environmental risk factors are things like alcohol use. So you can combat this by limiting your alcohol intake. So it's recommended for males to drink 2 glasses per day and women 1 glass per day. Not having children can contribute. Not breastfeeding can contribute. Hormonal therapy like birth control can contribute, as well as obesity can contribute because, like I said, the breast is made up of adipose tissue. The more adipose tissue, the more likely you're to obtain breast cancer. So you can combat this by maintaining a healthy weight and exercising regularly, eating healthy foods, fruits and vegetables and things like that. Okay, so what is the current guideline for breast cancer screening? There's so many different screening tests like ultrasound, MRI, things like that, but mammogram is like the golden standard, it's the most common. And what is currently recommended by the U.S. Preventative Task Force is women between the ages of 40 and 74 should obtain a mammogram every other year. I think this is so important to know because this has changed within the past couple of years. It used to be the age of 50 plus, but now it's 40. So if you're 40, between the ages of 40 and 74, you should obtain it every other year. And again, the earlier you detect this, the better. We saw how like the 5-year survival rate was 91%. And, that's just being proactive, making sure that you're, going for these regular checkups. If you have family history of breast cancer or you have that gene mutation that we discussed, you may want to have like an informed conversation with your primary care provider on possibly obtaining the mammogram earlier than the age of 40 because you are at a higher risk.
Dr. Anyasa, before you go on, one quick question.
Yes.
There was a question from the chat when someone said, I think you mentioned pain, and they're wondering what type of pain you should be feeling or you should be looking for maybe.
Yes, that's a good question. So pain, I mean, it's not, I wouldn't say if it's like a dull pain or sharp pain or anything like that, but I think the most important thing to know is like if it's a unilateral pain, if it's a pain on just one part of the breast that was not there before, I think that would be concerning. But I think also just seeing multiple parts of these signs together helps to get you the picture more. So it's not necessarily like a sharp or a dull pain. I feel like everyone kind of presents differently.
Thank you.
Thank you.
And really quickly, there was another question.
Yeah.
It says, given the hormones and birth control, what do you recommend as an alternative for a young adult, early 20s?
Yes, that's a good question. Again, these are, I wouldn't say that you being on birth control causes it. It contributes to it. I wouldn't say that there is like another alternative that I would recommend at this time. Yeah, I think that is tough. It is tough that it contributes, but I don't think there's an alternative that you could do aside from like barrier contraception with like condoms and things like that. But the two, like that's why I said the two that I focused on were the obesity and the alcohol use. You can really control those things by, eating healthily, limiting your alcohol intake. The other ones are more personal preferences. Any other questions that I may have missed?
There's a few more, but we're gonna save them until the end of your presentation.
Okay,
Mhm.
sure thing.
Thank you.
Okay, so what are some resources? Breast cancer resources include, I mean, there's so many, but these are just 5 of the ones that I liked. National Breast Cancer Foundation, National Breast and Cervical Cancer Early Detection Program, National Cancer Institute, American Cancer Society, and the Cancer Financial Assistance Coalition. A lot of these resources provide breast cancer screening services for free or at a very low cost, which is really nice because these tests are not cheap. So I'm gonna go ahead and go through the questions that were submitted ahead of time, and then we can go back to any additional questions that our audience may have or any other questions that were submitted in the chat. So the first question I have are, what extra steps can be taken when you're told that you, oh, excuse me, let me move these. Okay, what extra steps can be taken when you're told that you have dense breast? So I don't think there are any extra steps that can be taken when you're told that you have dense breast. Yes, you are at an elevated risk, but I think following the same guideline of getting the mammogram between the ages of 40 and 74 is what's recommended every other year. What is the best way for males that have breast cancer in their family to be screened? So again, mammogram. It's going to be the best screening test for males, especially for males that have an immediate family history. If you are diagnosed with a mass after a contrast ultrasound, how can the biopsy be negative? Are you not at risk? So for those who do not know, a biopsy is when you put like a little needle into the breast and you take out some cells, you look at it under the microscope, and you're seeing, is this cancer or is this not cancer? So how can the biopsy be negative? It's possible. Like there's no test or there's no thing that is performed that doesn't have a false negative rate. And what I mean by that is there is a possibility for the test to come back negative, even though you are truly positive or you truly do have cancer. You could accidentally take the needle you could accidentally take a sample from the nearby normal tissue and miss the diagnosis. And then also it could be that this individual may have like a benign tumor. There are some masses that present in the breast that are completely benign, that when you look at it under the microscope, it is not cancer. Number 4, is there a screening test for inflammatory breast? I had a hard time understanding this question. I'm going to assume inflammatory breast cancer. So there is no like particular different test or different screening tests. As we know, the inflammatory breast, there's not a particular mass or a lump. It's the whole breast is like inflamed. It has the pure orange appearance that we discussed. Mammogram is going to be the screening test for all types. Does carrying the PALB gene put you at risk for other cancers like prostate cancer? So PALB stands for partner and localizer of BRCA2. When you have like a mutation in this gene similar to BRCA1, BRCA2, you're at an increased risk of breast cancer. This also does put you at risk for other cancers. Yes, that is true, including prostate cancer, pancreatic cancer, and ovarian cancer. Even months after radiation, is it normal for the breast to tingle, be tender, or feel like it is trying to reshape itself? Yes, it is completely normal for the breast to tingle, be tender, and feel like it's trying to reshape itself. But the pain and the tenderness should get better with time. It should become less frequent with time. It should become milder with time. But like you said, like the breast is like going through a lot. And it's gonna, just take time to heal and get back to the way it was prior. Okay.
Thank you. So there's one question here. Another one, there were 2 questions, but I believe one was already answered. The question is, the frequency for mammograms being every other year is a bit concerning. The ACS is recommending every year. Why every other year?
Yeah, so there are different guidelines. This one's the U.S. Preventative Task Force. I know there are other forms of guidelines. I think every other year is because you need to give it enough time. You need to give it enough time to see what changes happen. I think every year would be a bit too frequent. If there is something like that is concerning, then your provider may recommend that you come back every year to monitor that and see, something that may have looked benign, may be, they want to continue following it up and make sure it doesn't grow over time, it doesn't become more concerning with time. But this is what the U.S. Preventative Task Force recommends.
Okay, great. Thank you for that. Let me see if there was another question. So no, you answered the one regarding dense breast tissue. Okay, so we're good for that. Thank you so much for your presentation.
Thank you so much for having me.
Yes,
Thank you all for your attention. If there are any other questions, please feel free to unmute yourself. Feel free to type it in the chat. We have like maybe 1 more minute, so maybe time for one more question if there is one.
And then we'll have our other 2 presenters, and then on the back end, we'll have additional time for questions as well. So anything at this moment that anyone want to ask? Okay. Well, we're going to go ahead and again, thank you, Dr. Onyeaso. Great presentation. We're going to move on to our survivor, Ms. Darese Goodwin. So Darese is going to share her amazing story with us. Take it away.
All right. Good morning, everyone. Can everybody hear me okay? I'm always worried about the mic when I'm on Zoom. So can everyone hear me okay?
Yes.
All right. So let's get into it. For most of you don't know me, I got my sister-in-law on. I am very, very open, very, very transparent about my journey. So this is a conversation. Please feel free to ask me anything you want to ask. I will probably answer more than you want me to. So with that being said, my name is Darese Goodwin. I am a 9-year survivor of stage 2 invasive ductal carcinoma, more commonly known as breast cancer. The way my diagnosis took place back in October of 2013, my doctor believes in doing baseline mammograms. And so she sent me in for a baseline mammogram. And I was probably all of 36, 37 at the time. I went in and had that mammogram, nothing was there. In January, I went to the doctor of 2014. My doctor did a hand exam and nothing was there. In March of 2014, I took a shower, laid in the bed, and I conducted my own hand exam. And in March of 2014, I found a little bitty lump in my left breast about the size of a green pea. What I knew is that was normal. It had never been there before. And so I immediately went to my doctor, who said to me, hey, you're only 38. Mind you, I said 38. I know the good doctor said that we wait for mammograms until we're 40, but I was 38 at the time. And I have 3 daughters. At the time I was going through this, my daughters were the ages of 5, 3, and 1. So I just had a baby who I also breastfed all of my children. So I go to the doctor, we do the mammogram. The lump was so small that the nurse, the tech running the mammogram couldn't find it. They had to have me mark it because I knew where it was. They marked it. They said, okay, they went and took pictures, got more pictures. They told me, hey, don't get your clothes on. We want to do an ultrasound too. And they did the ultrasound of my left breast and of my underarm. They said, hey, get your clothes on, but we want the doctor to talk to you. And I think at that point, I kind of knew like this was it, right? And so I meet with the doctor, the radiologist who's looking at the images. He said, we got to biopsy this. We got to look at this. And he asked me who found this lump. And I told him I did. And he said, the lump is so small, you shouldn't have found it. So thank God for that, right? So they did the biopsy the next day. They gave me the biopsy. That was on a Friday. On Monday, I got the call saying that I was positive for breast cancer in the breast and in the lymph nodes. So at that point in time, it starts a flurry of doctor's appointments and phone calls and visits and tests. And I think the one that stood out the most to me is after I had the biopsy, the first person they sent me to was the surgeon. And so I met with the surgeon out in way out somewhere. And I said, hey, I got this figured out. I want a bilateral mastectomy. And she did her best to talk me off of that ledge. And so it was me and my husband and my best friend and my mother in a room. And we argued that day. I argued with the doctor like, hey, no, I got it. I want a bilateral, take them off. I don't need them. I have 3 girls. I breastfed them all. We're not doing anything with them anymore. So let's go. She refused, absolutely refused. My husband said and confused. He's like, why wouldn't you just do what she asked? And so she was so upset with me for asking for this thing that she said to me, we're just going to send you for an MRI of the breast. Okay, fine. I went and did the MRI. I came back to her after the MRI and she walked into the room and she said, hey, we're going to take the left breast. And so I said, well, oh, all right, well, take them both, but I just want to know why you had this change of heart. And so what they found in the MRI, when you draw a circle of the breast, for the breast, and you divide it into 4 quadrants, the whole lower left quadrant of my breast had an 8 to 10 centimeter area of cancer that had never formed a lump. So the cancer, while non-aggressive by its pathology, I was what they call ER and PR positive and HER2 negative, right? That kind of deems it as being a non-aggressive growth, had been there for so long that it touched lymph nodes. And so that whole lower left quadrant was full of cancer cells that never formed a lump that could be felt or even picked up by a regular mammogram. Because remember, I had mammograms in 2013 and early 2014, right? So at that point, I argued again with the doctor and said, you're gonna take them both. She didn't want to do it. She refused to do it. She wanted to take one. And at that point, I had already met with an oncologist who told me that I would start chemo. And so for me, I had 16 rounds of chemo. I did a medicine called adriamycin and Cytoxan. I had 4 rounds of that. And then I had 12 rounds of another medicine called Taxol. So 16 rounds of chemo, 4 rounds every 2 weeks. And then that last 12 was every week I was in chemo. I never got sick during chemo by the grace of God, never vomited, nothing, never. I think the worst chemo did me was I was extremely fatigued. I was able to actually work all the way through chemo. So 16 rounds of chemo. After I had chemo, well, in the midst of chemo, they sent me for genetic testing because I am the first person in my family to have breast cancer, not cancer in general, but absolutely breast cancer. And so they sent me to Dr. Olapade at the University of Chicago for my genetic testing. And there I tested negative for BRCA1, and for my BRCA2, it came back as a rare variant of unknown significance. At that point in time, Dr. Olapade said, listen, they're going to take the breast and the ovaries. And so that was the big question, like, are you done having children? Yes, I am done having children. And so by the time I finished chemo in late October, middle October. By late October, right before Halloween, 9 years ago, around this time, 9 years ago, I went in for surgery where they removed both breasts with a bilateral mastectomy and an oophorectomy where they also took my ovaries. I believe, and the doctor can correct me if I'm wrong, if I'm not mistaken, the ovaries came in play because breast cancer and ovarian cancer are sister or cousin cancers. And also because my cancer was estrogen positive and ovaries kind of help with your estrogen production. So they wanted to rid my body of that as much as possible. After the surgery, I then went on to need 33 radiation treatments because when they removed the breast, they found that 2 of my lymph nodes underneath my arm were still positive for some of the cancer there. So they went on to continue with the treatment where I had 33 radiation treatments. I started chemo in May of 2014. I was done with all treatment, radiation included, by January of 2015. From there, I am now on a medication called Arimidex or anastrozole. which acts as a hormone inhibitor for me, and I have been on that for 9 years. I do have a new oncologist who told me we could talk about coming off the medicine sometime next year, but that is my story. And so I'll say all of this to say, when I first got diagnosed, one of the oncologists that I had, I called him Dr. Doomsday because I felt like every time I went to see him, it was bad news. But he said to me, I lived in Country Club Hills at the time. He said to me that the toughest cases we see of breast cancer are Black and brown women on the south side of Chicago. Black and brown women south of 35th Street have the toughest cases of breast cancer. And I asked him, why was he so comfortable being able to say that to me without having a definitive answer as to why that is the reality for so many sisters on the south side of Chicago, and still just no answer. And so where I lived at the time, in Country Club Hills, it was a 4-unit condominium building. I lived on the second floor. I had breast cancer. The young lady across the hall from me on the second floor also had breast cancer. And the young lady underneath her had lung cancer. And so when we started talking about environmental factors and genetic factors, genetically, who knows, maybe, I don't know, I held some of that. But environmentally, I didn't smoke. I don't smoke. I don't drink. I had 3 children. I breastfed all of my children, and I still got it. And so I think that my biggest thing is like, be your own advocate, go to the doctor, get checked out, do your self-exams. And if the inevitable, if the craziest thing happens, do everything your doctor asks you to do, and just really, 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 really advocate and fight for yourself. I think that's all I got. Any questions?
Thank you so much for being so transparent and sharing your amazing story. Appreciate it. Are there any questions for Ms. Tyrese?
I don't have a question, but I do have a comment. Just want to say that this was really an amazing story. And I think the biggest part that I got was how you did your own self-exam. And the doctors couldn't even find it, and you had to point it out to them, showing the importance of advocating for yourself. So
Yes.
thank you so much for sharing that. And for you to be so young, I think you said was it 36 or 38?
I was 38. I
Mhm.
was 38, but you know what's crazy? What happened 2 years prior to that, before I knew I was pregnant with my last baby, I had a mammogram, and they said they saw microcalcifications, same breast. And I went in for a biopsy, and they cleared me from that biopsy. They said that it was nothing there. And then 2 years later, after I had my baby, after I went through pregnancy and had my baby, I came up with stage 2 in the same breast. So I feel like it had been there all along for years and years and years, and just never got caught. And I think somebody asked about, and I am not a doctor. I work for Cook County, but I think somebody asked about the dense breast tissue.
Mhm.
Like at that point in time, I think that we need to somehow, some way demand diagnostic mammograms, because I just feel like maybe it could have been caught sooner, just
Mhm.
maybe.
Thank you for that. Another thing I did want to point out too, I think it's just how everyone should be checking doing breast exams, regardless of whatever people say who's, more at risk. Because I think, and again, the doctor can kind of jump in here. Some of the risk factors are women who never have children, right? But you had children and you breastfed. And you said you don't drink, you don't smoke. So I think everyone, again, it's just the importance of everyone doing these checks.
Yeah, and I think what also I would want to point out is the fact that I was in chemo, like with a number of people, but in particular, 3 other women who also had breast cancer who were all under 40. And one of them was pregnant, and she was going through chemo. And so I think that, I appreciate the fight to say, get your mammograms at 40, but I would appreciate it more if we could fight and say, hey, start at 35. Like the main proprietors of breast cancer, the names we hear, Susan G. Komen was under 40. She was under 35 when she was diagnosed and died. Minnie Riperton, under 30, I think. when she was diagnosed, and I think 31 or 32 by the time she died. And so, there has to be some changes, I think, in the guidelines, because more and more we're seeing young women diagnosed with this thing, and it's not getting better.
So much for saying that, because again, I just found out recently, like as of like a week ago, that a friend of my daughter's just finished up her last session of I think chemo or radiation, and she's like maybe she's her late 20s, maybe 28, 29, so very young, and also had a coworker who lost her daughter at age 25 to breast cancer. So these screening standards, I really, really hope that something can be done so that they can be done at a lot earlier age. Because again, like you said, doing your self exam is what helped you to figure it out. A lot of us do them and feel like, oh, this isn't gonna, I feel the same thing, or, it feels lumpy all the time. So what's the difference? So we don't do them as often as we should. But
And
um,
it's imperative, because like, let's even like dispelling the age, right? Just women in general, we are so busy with life. We're so very busy with life. Like, I had 3 daughters in 3 different sports. And just earlier this year, I pushed my oncology appointment back 3 times. And then finally I said, "What are you doing? Go to the doctor. What are you waiting on?" But I got competitions and games and practices and things like that. When I went through, I did blog on Facebook. Every time I had a chemo treatment, I would go to Facebook and say, "This is what I learned during this treatment." And so women were coming to me, the women that I worked with, women who worked in my kids' daycare, who were 50 and 60 years old, saying they had never had a mammogram before. And it's like, what are we doing? So whatever we can do to advocate for our community, our Black and Brown community, I'm for it.
thank you so much, Doris. All right, thank you for that presentation. So now we're going to move on to Gianna. Thank you again. And again, please stick around, because if you have additional questions for our panelists, you will be able to ask them at the end. And then we also are going to have a raffle. But again, I'm going to turn the floor over to Gianna. Thank you for being here.
Thank you for having me. And thank you, Doris, for sharing your story. Your story is the reason why we do what we do here at Equal Hope. So I'll just share with you all about Equal Hope, how we came about, why we came about, and the services that we have to offer to individuals here in the community of Chicago. We know that all women deserve equal hope and an equal chance at survival. And we know also that there's unequal access to high quality healthcare is a significant driver in overall healthcare disparities, including breast cancer mortality in Chicago. And why do we know that? Because there was some research done, really disturbing research that was done looking back in 2005 to 2007, that there was a large and growing disparity of mortality from breast cancer between Black and white women, 62% greater chances of dying from breast cancer amongst Black women in Chicago. And there was also an unequal distribution of resources. You can see that predominantly, as Doris mentioned, south sides of Chicago, west sides of Chicago are communities of color, Black and brown women. And then you can see in that little triangles, let's see if, I don't know if you can see my little mouse, these are some hospitals with American College of Surgeons approved cancer programs. This is once again back in 2005. There has been some changes recently, so this map does look a lot better, but this is why we started. Because of, you see our communities, and then you see that there's lack of quality resources within our Black and brown communities. So that's what inspired Equal Hope. We were formed in 2007 at a breast cancer summit, a call to action. There was a report suggesting 3 areas that might drive this health inequity, including unequal access to mammography, unequal quality of mammography, and unequal quality and access to treatment. So you might have heard of Metropolitan Chicago Breast Cancer Task Force. We started, became a 501c3 in 2008. A few years ago, we changed our name to Equal Hope, rebranding. We were still kind of informing individuals that that's who we were, because I believe once we rebranded to Equal Hope is when COVID hit. But Chicago Breast Cancer Task Force is our former name. And this is our mission. Essentially, we want to save women's lives by eliminating health disparities in Illinois. And I don't want to read through the whole thing, but we have a team very passionate for our mission and vision of the organization. And we have a unique approach. And that unique approach is a threefold type of approach. We develop a model that combines community healthcare collaboration, community embedded approach that saves lives through, there's Equal Hope and patient navigation and education and outreach. We have Equal Care, it's a quality consortium. We do quality measurement and improvement, and an Equal Voice advocacy and policy. We believe that this approach was required because first you really need to understand what is the landscape, what are scientific research, and what is going on in our communities, right? We have some advocacy and policy because once you figure out what is happening in our communities, what can we do about it? What is the call to actions? And then what type of quality of mammography do we have within our communities? So that's why we are a quality consortium doing surveys and understanding what type of mammography do they have, what's the turnaround time of providing information, diagnostics, the time from someone can get a clinical breast exam to when they can get a diagnostic or a biopsy. What are those turnaround times of each facility? So we have a huge quality consortium team, and I oversee our patient navigation education team, which I'll dive into a little bit more. Once again, just going through our model, we do that landscape analysis, which is just assessing the healthcare system and its disparities, mapping it out in Chicago, as I previously showed, developing a quality scorecard, identifying what is quality, what is the highest quality that a person can get for a greatest chance of survival. And then the big 10, which is my favorite, is community partnerships, really combining both medical homes, hospitals, community-based organizations, because it really does take a village to address this nationwide concern, and community concern and citywide concern in Chicago. And then assess how the healthcare system works in real life, which can be very complicated. So really understanding like from what point to what point does individuals might need further assistance and support. And then listening from patients and their experiences and the community and what can we do better to ensure that they're receiving the best quality care that they need. So in 2017, it was shown that the work that we've been doing since 2008 has been working. Chicago is #1 in the nation for improving breast cancer survival for African American women. I know the photo's a little bit blurry, but that does say 13.87% increase in African American women's survival from breast cancer, which is amazing, but we're not done. There's still so much more work to be done. This is from the Chicago Health Atlas, most recent data that was put out there. You can see for COVID rates, just distribution, the darker the color, the higher count of mortality there is in that neighborhood. And so this is for COVID, heart disease, and I mentioned that because we also do some medical home placements to just address overall a holistic healthcare. And there's breast cancer and cervical cancer. And I just want to highlight once again, you see the darker areas are on the south and west sides of Chicago for the most part. And we utilize this data along with our quality consortium data because it really tells us how and where do we need to focus our efforts? Where is the outreach going to be done? Which medical partners should we be working with? How far is the transportation from one facility to those individuals' home? And that really kind of assists us with formatting what is our program going to look like. Just also wanted to share this because we're talking about breast cancer, but cervical cancer is also very important to highlight, and that Black women in Chicago die 2 times more than white women from cervical cancer. You can see this is per 100,000 population, 2.2 for non-Hispanic white, and 4.6 for non-Hispanic Black. Just showing you for breast cancer over here, you have 22 per 100,000 dying from with non-Hispanic white amongst for breast cancer, and then 29.4 for non-Hispanic Black. Others also showing data for Asian and Pacific Islander and Hispanic or Latinos. And I just thought this was very striking. This was data back from 2017. Once again, we have seen some significant improvements, but I don't know if too many people are familiar, but Washington Park and Hyde Park are neighboring communities. So a woman living in Washington Park is 85 times more likely to die from cervical cancer compared to a woman living in Hyde Park. And I say that because these disparities also mimic what's happening with breast cancer, and that it's not just genetics, as Doris has mentioned, but there's also social determinants of health and different barriers in access and quality that we have to think about when we're thinking about this chronic condition. And so just going back to our threefold of quality measurement and improvement through equal care, we looked at disparities, mapping resources, measuring quality, looking at care practices, really understanding what's happening in our communities. And then we're advocating for those changes. So Equal Hope has been part of a few of these policy changes, such as Breast Cancer Disparity Reduction Act, a public law enacted in 2012 to improve upon the prior bill, the BEST Act, Breast Cancer Excellence in Screening and Treatment. We're increasing funding for the Illinois Breast and Cervical Cancer Program over the last 5 years, reducing cervical cancer and saving lives. We have a policy department, and so we're still working in the actions. And if anyone wanted to be part of the policy work that we're doing, please feel free to reach out to me and I can get you connected. As far as community outreach and patient navigation, I'm proud to say that with our wonderful outreach team and navigation team, we're reaching over 100,000 women a year, educating over 60,000 in community settings, navigating over 1,600 women to high quality care. Our goal is to hit a 75% completion rate of screenings, and we're seeing around 83%, which is wonderful when we're thinking about the communities that we work with and the type of also follow-up rates that we're typically seeing in those facilities. So to get into our program, there's the initial contact. Initial contact is typically with our outreach team. We're street canvassing. What's so great about our outreach team is it's a community health workers based led. So they're boots on the ground. They're from the community. They speak like the community. They interact with the community all day and out. So there's that level of trust that's built. So there's an initial contact through either street canvassing, going to the community events, community partnership meetings, and more. Once someone is interested and other than more than just education, but wants to sign up for services, there's an intake that we do. Then we can do a program enrollment. We look at that intake and identify which best program they would fit in, because we have multiple programs. We have an Equal Hope cancer screening program. We're part of the Illinois Breast and Cervical Cancer Program. We do medical home placements. We address social determinants of health through our Wellness West program. And then we provide the services. So some of those services, I can get into this again. Outreach and education, kind of mention what we do in terms of street canvassing, community events, and more. And I say that because we also do health education presentations, and our outreach workers are the ones that do those presentations. So if you ever want them to come out, they speak at churches, they speak at maybe work settings with staff. They can go out almost anywhere. October, we're really busy, but they love to get out there and provide the education to the community and be vendors and set up tables in front of schools, whatever is needed. And so you can always reach out to me for that. As I mentioned, the Illinois Breast and Cervical Cancer Program does provide free breast and cervical cancer screenings. And as was mentioned earlier, it's expensive. So if individuals is uninsured or underinsured, and they can fall within the age range for For this program, the age range is listed as 40 to 64, and it stops at 64 because typically individuals get on Medicare at 65 and over. However, that's not the determined criteria because we have been seeing a lot of younger women in their 30s wanting to sign up for services because they're experiencing some type of symptom. And with a clinical breast exam, if the provider is reporting the symptoms, we typically get them approved, and it's like a 48-hour turnaround time where we're getting the approval. So that shouldn't deter anyone from wanting to sign up for the program. And then for Medicare, depending on their Medicare plan, if they do not cover the breast or cervical cancer screenings, like maybe a biopsy or the diagnostics, if that's not covered, then they can still be part of the program. Our breast screening program is just an extension of other hospital facilities. So what's so great about Equal Hope is that although we sit on the Rush campus, we work with all different hospitals, U Chicago, Loyola, Advocate. So we really want to send individuals to a facility that's close to their home or that they prefer. And that's why we like to expand, and we are contracted with multiple facilities throughout the city. Sometimes those same individuals might need a primary care doctor because they just haven't been connected yet. So we do medical home placements, and we actually pay for that first visit, which can sometimes be expensive if they're doing lab work, and we can always provide transportation to that. We do quality navigation assistance. Our wonderful patient navigators are scheduling those appointments, providing reminder calls, follow-ups. If have they went, do they need a follow-up appointment? Do they need someone to accompany them to their appointment because they might need that additional support? Our navigators do all of that work, and half of our team is bilingual, which is wonderful. And then we also do nurse navigation for individuals who might just need additional support through their diagnostics, biopsies, or through treatment. And then we address those social determinants of health. Although we only provide direct transportation, like an Uber or a Lyft, we can call that for them to get from their home to their screenings. For other like food insecurities, housing, or more, we are partnered with so many different community partners in Chicago, and so we work with them and 201 Now PAL to get them connected as needed. So patient retention, how do we get individuals to continue to follow up and be consistent in the process, in their journey? I believe there's that level of trust. Once again, our team is from the community. They speak like the community. They are very passionate about the work that they do, and you can hear them on the phones. They're very considerate and compassionate when engaging with patients, and so there's that trust, authenticity, follow-up, and engagement. Constant follow-up, calls, emails, mailing. We don't want to close cases like within 2 months. We're like, let's just keep following up. We want to get these individuals who are falling through the gaps into care, and that is our goal. So once again, assisting through relationship building and those follow-ups. And then although IBCCP, the Illinois Breast and Cervical Cancer Program, and our breast screenings programs are preventative, it's mammographies, everything that you're doing to see if someone potentially might have breast cancer. We don't stop there. We follow individuals throughout the continuum of their journey. There's cancer navigation and post-treatment navigation. So that's our nurse navigators. We have also a bilingual nurse navigator, 2 on staff. One has been in the field for a long time and just has just so much experience and compassion and passion for the work that she does. So servicing the person, not symptom or diagnoses. Treatment services not only address the individual, but their families. And so we do connect with like Gilda's Club and other Unite for Her, other organizations that can provide additional support if needed. And this was just a beautiful quote that one of our patient navigators has stated: people don't care how much you know until they know how much you care. And that's what we pride ourselves on, and ensuring that people know that Equal Hope cares and we're there for them. And because everyone deserves equal hope of access to quality healthcare, everyone facing a serious illness should have equal hope of early diagnoses, quality treatment and recovery, and everyone should have equal hope that we can eliminate inequities in healthcare for every member of our community. And I wanted to just share that this month we are doing our first inaugural restaurant tour. And we're really excited about this tour because we have worked with different restaurants throughout the city, and a lot of them are Black and Brown owned. I would say the majority of them are Black and Brown owned, and they have committed to donating a percentage of their earnings for the specific day that they signed up for to a mammogram to support someone who is uninsured and cannot afford a mammogram. They are willing to donate their funds to Equal Hope so that we can provide that service. And so it's this continuum in that we are highlighting the restaurant, which are community restaurants, Black and Brown owned businesses. We're putting them on our social media, our websites, really trying to share and let people know about what this restaurant has to offer. So that's how we're giving back to the community, and they're giving back to the community by donating for mammograms. So you can scan this QR code. It'll show more information about the restaurant tour. And if you see any restaurants, we still have 2 more weeks or so, or a week or so of dates of that you can go and eat. Everyone likes to eat. So feel free to go out there and give back and reimagine awareness. And for more information, you can call us, visit us at equalhope.org. And I also provided my contact information. And I will stop there.
Thank you so much, Gianna. Amazing, amazing presentation with you guys provide so many great resources. We thank you so much for sharing. Does anyone have any questions for Gianna? And all of the resources that she shared along with the QR code that will also be shared with you in a follow-up. So we can see about this restaurant tour. Sounds exciting. Sounds fun. So any questions? Okay. Do you guys only serve Chicago, Cook County?
We are in Cook County and Lake County.
Okay. So, yes, she said great presentation. So if anyone has any questions or any shares that they would like to, now is the time. I'll open up the floor to you all. If you have any questions for our presenters, or if you just want to generally just share your story or anything.
I have a quick question. I just want to know, are there any other survivors here? If so, would you like to maybe just say something in the chat, or like you said, unmute yourself? I just want to know if there are any other survivors here.
Yes. I'm sorry. My name is Crystal. I am Aisha's cousin. I am from California, San Diego, California, and she invited me. And I'm a survivor. I was diagnosed in 2018 at 49 years old. And I was diagnosed from calcifications. I did not have lumps or anything. But I went to go get my mammogram yearly because of my dense breast. And so they monitored for 6 months. And then I went back, and the radiologist, he just wasn't comfortable, and he wanted me to have a biopsy. And that's how I was diagnosed. But I'm very impressed with what you guys are doing in Chicago and the stories that I heard and the informative information, because it is so informative that we do be that advocate for ourselves as well, be persistent in our care, because sometimes, you can go to get mammograms and they don't see anything. And mine was yearly. So that year before I had nothing. And then I went back and it was abnormal. So, it's just, as Black women, we need to be persistent. We need to take that time and take care of ourselves. So I really appreciate this time. So I just wanted to share that as well. And I had DCIS, so it was still in the ductile. Okay.
Thank
Um,
you
hi,
so much. Thank you so much for sharing.
good afternoon. My name is Diane Powell. I am Aisha's soror. I am a 2-year survivor. I was diagnosed at age 75, and I actually did submit a question. I don't know what happened. It didn't get to you, but my question was wanting some information on the reoccurrence rates.
Yeah,
Maybe
that's
that's,
oh, okay.
no, go
Yeah,
ahead.
good question. I don't have that offhand. I can get back to you on that.
Thank you.
So sorry I missed your question, but we'll make sure to get that to you. She's also
Okay.
my godmother too, so she'll be to make sure that I get this to her.
Well,
Mm.
I have a question for Miss Diane. I just
Yes.
want to know 75 where? Because I don't see, I don't see, but okay, girl.
Well, I'm actually 77 now, but
Oh,
I was diagnosed at 75.
you look
And
fantastic.
thank you so much. And I had mammograms every, as it was prescribed, I think every year, after age 40. And so then 2 years ago, I went in and had the same experience. Then they had me to come back for the more extensive view, and then I had the surgery. But fortunately, the tumor was like they said, like the size of the head of a pin.
Mm.
Very, very tiny. So I didn't need chemotherapy or the medication. But I do take the pill you take for 5 years, so I'm my second year on that.
Okay.
Thank you so much. Anyone else? Check and see if we have anything in the chat. But again, if you would like to share your story, that's fine. If not, or if you just have any general questions, now is the time to unmute yourselves.
I don't have a question, but I did want to acknowledge the people who mentioned that they are thrivers. Thank you to, am I pronouncing it correctly? Antisar?
Yes, I'm sorry. Thank you.
Antisar. She suggested thriver instead of survivor. So we have Antisar. Carmen's a 16-year survivor. Francine is a 23-year survivor. So thank you all for coming.
Thank you. I'm a 10-year. This is
Thank you
Antisar.
for having me.
Thank you so much. We have Janetta who was saying something.
Oh, yes. Hi, everyone. My name is Janetta. I am actually a friend of Miss Aisha's daughter. I am a 7-month survivor. I was diagnosed at, I'm sorry.
Your time.
I was diagnosed at 27. It was last year in 2023. How it happened is I was just putting on lotion one day and I felt the lump. I didn't think too much of it because it was small. And I had a doctor's appointment 2 weeks later. So I said I'll just mention it once I met the doctor. So I mentioned it and my doctor sent me for a mammogram. And I went for a mammogram and a biopsy. And they told me they would call me back with the results within like 5 to 7 days. So those 5 to 7 days went past and I didn't receive a call. So I kind of had an idea then that something wasn't right. So I actually called them. And when I called them, the nurse told me that I would have to wait for the doctor to call me back. So we got off the phone and the doctor called me right back and she let me know that I had HER2 triple negative, stage 4. Stage 4 breast cancer. So from that point, everything was fast. I got my party in and I started chemo a month later. So the mass had grew from 1.5 to 4.7 in a month. I'm sorry.
No, take your time. Take your time.
So I had 16 chemo sessions, 18 immunotherapy sessions, and 20 radiation sessions. I finished my last radiation session in June, and I finished my last immunotherapy session in September last month. I was just able to get my port out October 6th. So that was the last day for, I feel like, the this new journey that had came upon out of nowhere. So I just would like for younger women to, take that initiative, check yourself and go get checked out, as everyone has said, because it's so important. I didn't think being 27 years old with a 4-year-old, I didn't think that breast cancer would be in my future. So just now, so this is actually my second time speaking out on it. I'm learning that me speaking can help a lot of people because my story is not typical. That's it. Thank you guys for listening.
Thank you for sharing. I think that was very, very brave of you to share this, and just want you to know that I will be thinking about you and have you in prayer.
Thank you. Thank you.
Absolutely. Thank you so much for sharing, Janetta. Again, it touches me in a totally different way. But again, just finding out, it was just such a shocker. But prayers up to you. Continued prayers for your continued healing. And I'm here for you. And again, thank you so much for sharing. Thank you for your vulnerability. Thank you all for sharing your stories. We appreciate this because you did not have to, but just sharing lets others know, what can happen, what they need to look for, and just, that it's something that happens. But again, this makes it also real. But I just appreciate the candid conversation from all of you. But thank you so much. Anything else? Any other questions? Any other comments? Okay. So as I get myself together, we are going to, if there are no other additional questions or comments, and again, thank you to all the thrivers who posted in the chat about their survivorship. We appreciate that. Thank you to our presenters, Gianna, Dr. Jessica, Doris. Thank you so much. So now we are going to move on to our raffle. Well, hold on. Okay. Can you all, okay, move on. So again, just wanted to mention the upcoming events that we're having. Again, this will be in the follow-up email, our high school healthcare career panel and our Women and Girls Health event, which is both of these are in-person events. I'll send them out. And then we have our Friendsgiving event that's also an in-person event, which is in recognition of Diabetes Awareness Month. So that's November. And again, please follow us on social media at UCM Urban Health Initiative. This again will be in our follow-up as well. So please follow us. We post some really amazing resources and information, upcoming activities. It's just great stuff. Thanks to our wonderful Brittany who leads this and making sure that our social media posts are amazing. So we'll also send you out a survey. If you haven't had a chance to fill out the survey, which has been posted in the chat, no worries, because we will send them out in our follow-up. So you can you can fill out the survey to let us know what you thought about this workshop, if you have any suggestions for any upcoming workshops, and also just have a chance to win a prize. This is our contact information. Again, something that'll be shared if you need to reach out to us, if you're looking to have any events that you'd like for us to participate in, whether it's virtual or in person, please reach out to us. And so now we are going to do our raffle. And let me stop sharing.
I can share my screen.
Yeah.
Okay, obviously, Equal Hope website. I put the link in the chat. It's pretty easy, equalhope.com. But again, Aisha will share that information following up. And again, thank you, Ms. Calisto, for coming to speak. I know Equal Hope has a ton of resources. I remember working with Equal Hope at a few different jobs, actually, when they were Metropolitan. So it's kind of cool to see the evolution of that program. They have, again, amazing resources. Really quickly about our raffle prize sponsor, it's TGIN, Thank God It's Natural. It is a woman-owned business, but I also just wanted to share, I don't think a lot of people know this, that the former CEO and founder of TGIN also was diagnosed with breast cancer at the very young age of 36. She passed in 2021, but they continue with now the TGIN Foundation. And they also provide rides to people who are battling breast cancer, and they provide those services through Lyft, also education. So just kind of want to share that about our sponsors. So it's kind of cool that we have someone who has a connection to and a mission for breast cancer. And I actually used to work with Christia. I used to work at TGIN. So this is an organization dear to my heart as well. But with that, we have everyone's names here. Thank you for showing up. And we're going to go ahead and see who's the winner. Okay, so you have to be here. Is Miss Diane Powell still on?
Yes.
Okay, all right.
Congratulations.
Thank you.
Wonderful.
I never win anything.
Well, you won today.
I did. Thank you so much.
Absolutely. So we'll get that mailed out to you. Absolutely. And you know what, Brittany, if we could, I have a tote bag that's we can possibly give away as well. So we can do one more spin that I can send out. Let me show you. See if I can show you on the screen. If you can wait. Hold on, let me take this off so that you all can see it. Okay. So
oh, cute.
It says strength. It's just a little reusable bag. And
okay, so I still have it up there, so I can go ahead and do one more spin. I'm gonna remove you, Miss Powell, since you already won. Okay. Okay. Okay, Sakina Ghazali, are you still in the room?
Are you here? Yeah. Hey, Sakina. You here?
Yes.
Okay, great. So yes, yay. Congratulations.
Okay, Okay, awesome. And then what I also wanted to do, I have the names here of everyone who said that they are a thriver. We have, I think, Miss Diane Powell, Krista Cooper, Auntie Sar, Carmen Ross, Francis Whitaker, Janetta White, Jeanette Samuel, Tawanda Jones, and obviously Doris Goodwin.
If you want to get your flu shot.
I am going to make sure that all of our thrivers get something in the mail as well. So we'll obviously have the first winner, Diane Powell, will receive the TGIN products. Sakina will receive the tote, and then all of our thrivers will receive something else from the Urban Health Initiative as well. So we'll make sure we'll get everyone's contact information.
Because right now, yes, that sounds great. So we do have you all's email addresses. So we'll reach out to you through email so that we can get further information. Okay, any other closing remarks from our panelists?
Thank you so much for having me. Really appreciate it. And if anyone wants to get connected with Equal Whole, please feel free to reach out. And if you want more information on the Breast Restaurant Tour, let me know. I'll put my email just in the chat.
Thank you so much.
Yeah, thank you all for having me. It was a pleasure being a part of this. Thank you for being vulnerable and sharing your stories. It really was powerful.
I'm going to echo the doctor and Gianna and say thank you so much again for having me. It's always like, for me, just very, very fulfilling being able to share and being able to meet the folks that I'm going to continue to pray for. Janetta, you have touched my soul this morning. I am praying for you. Okay. And I just love you guys. Thank you.
Thank you so much. Thank you all. I appreciate you all's time, your vulnerability, your everything. This really does me good. I've been a breast cancer advocate for many years now, so this is one of my favorite workshops to facilitate and be a part of. So again, I appreciate you all wholeheartedly for participating, for sharing, for presenting your knowledge and skills and everything today. It was just amazing. And I hope that everyone has a wonderful Saturday and rest of your weekend. Thank you so much. And again, please look for this. This is recorded, so we're going to post it on our Facebook page if you want to go back and rewatch it. You got to follow us at UCM Urban Health Initiative to go to our page, and you'll be able to rewatch this, share it with family, friends, and just go back and just check it out. But again, thank you all. Thank you all so much. I appreciate you all today. And if you have any questions or anything, please feel free to reach out to me, and we'll be in contact with you. Thank you so much. Have a great rest of the day.